I'm Sue O'Connell. Tonight on Greater Boston, strains on the healthcare system are making it hard to get a primary care appointment in Massachusetts. What's causing it, and what are the consequences? Plus, how does the end of federal COVID emergency declarations factor into it all? Then later, the bond between a mother who lost her son and a local heart transplant survivor who was saved by her son's donation. It's been 3 years since COVID first hit Massachusetts, forcing schools and businesses to close their doors and millions of residents to stay at home, pushing off everything from family gatherings to healthcare appointments. And since then, a lot has changed. The world's reopened, vaccines and treatments have made the virus a lot less deadly for many. And earlier this month, President Biden announced federal public health emergency declarations surrounding COVID will end in May. But when it comes to health care, as many as 2 million people in Massachusetts are still falling behind. According to the latest numbers from the state Center for Health Information and Analysis, more than 1/3 of residents say they've had trouble getting necessary health care. And as always, people of color in the state have been hit even harder. So what's making it so hard for people to access the care they need? Joining me to discuss this and the state of COVID here in Massachusetts is Dr. Katherine Gergen Barnett, the Vice Chair of Primary Care Innovation and Transformation at Boston Medical Center's Department of Family Medicine. She's also a clinical associate professor at BU School of Medicine, an associate at Harvard Center for Primary Care, and a Health Innovators Fellow at the Aspen Institute. Other than that, though, you're just sitting around doing nothing, right?
I'm so pleased to be joining you.
Great to see you.
Thank you.
All right, so let's start with the buildup of back appointments.
Yeah.
I mean, there's a statistical, mathematical funnel issue here, right?
Yeah.
Lots of folks couldn't get appointments. There's an urgency to some people who needed appointments. Where are we with the funnel ratio here for folks who are just trying to get back on the saddle of seeing their doctor?
So I think we have a perfect storm where coming into the pandemic, we already had a system that was stressed. So, you know, the statistic that you give is really focusing on primary care and how are people getting in to see their primary care physicians. Coming into the pandemic, we knew that there was not enough funding for primary care. We can talk more about that. And we also knew that people were already stretched thin. Put on top of that 3 years of this massive overhaul of health, having us step in for everything that we could be, not to mention having the mental health crisis that we have, all kinds of needs of populations coming up. And now, as you indicated, a number of people just coming back to primary care and to health care. And so already you're thinking about why is the funnel so difficult? And then you think about what's on the other end of that funnel, which is a hospital system, which is incredibly backed up. So, you know, for people who are sick, they can't really get into the hospital. And the people who are trying to get into nursing homes have a hard time getting into nursing homes or long-term care facilities. So there's lots of points of that vector where it's difficult.
Let's look at a couple of numbers here. For folks relying on emergency departments from 2015 to 2019, the breakdown of ethnicity and race, Black 20%, Hispanic 29%, which is a larger number than white folks who are leaning on emergency departments. And then if we look at the other part of the funnel conversation, primary care physicians who left the profession in 2020, according to the Center for Health and Information and Analysis in Massachusetts, 3.6%. Nationally, that's 3.3%. May not seem like a lot, but it is a lot when you come to just to Massachusetts. So we're seeing sort of the problems we had before the pandemic still there.
Absolutely, and getting worse.
Yep.
I think the emergency room piece and then people leaving primary care are two separate but related pieces, right? So the statistics about Black and brown folks going to the ED at higher rates, part of that is there's not a good access. We know we have a healthcare system that is inequitable, that doesn't provide the same kind of access. I work at a place called Boston Medical Center, so, you know, we're very thrilled that that's part of the work we do, but it's not sufficient. efficient. And then part of it, to what you're alluding to, is people leaving primary care. A lot of people talk about it as burnout, the sense of, you know, a person just can't take it anymore. And you know, as much as 1 in 5 physicians is supposed to be leaving or is indicated that they leave the profession because of burnout. But frankly, I think myself and some colleagues really want to talk about it as a moral injury. So it's not the problem of the individual. It's not their fault that they can't hack it. It's fundamentally the system has failed them. It's failing all of us.
So what do we do? I mean, this is the challenge. As I've shared with folks, with my daughter's permission, she's got a number of chronic illnesses. We're in the system all the time. Her primary care physician, which was new, which she got just at the beginning of COVID, she's leaving. You know, she's moving to a different to a specialty. She only saw her in person like once or twice, maybe, because of COVID. That's going to take a toll on treating your patients, that you don't get to interact with them in the way that you sort of signed up for. I'm seeing some reports folks are entering the medical care profession because of what they saw in COVID. And at the same time, you know, dealing with the insurance companies, dealing with how long you can stay with patients, those things haven't changed either. Those are still hurdles. Yeah. So what do we do?
Yeah, do you have all day?
Yeah.
I mean, a lot of us are thinking about this all of the time. Yeah. So fundamentally, you know, to come to the medical school piece, right? So you have seen that more people are going into medical school, which is terrific, or healthcare professions. The question is how many of them are choosing to go into primary care? So we know that medical students see primary care clinicians having this huge burden of responsibility on their shoulders. We are being asked to do more and more, target more and more metrics, some of which feel out of our control.
Well, also the mental health part of it.
100%.
You know, I heard a pediatric primary care physician on a podcast talking about how when she was trained, it was here, you go see this person.
Yeah, and now we're that too.
Yep.
Which actually, a good primary care doctor can be that.
Right.
If we have the time and the capacity to build those relationships, we are trained, especially in family medicine and in other specialties, internal medicine, pediatrics, we are trained to do that work. We just aren't given the time. So if you're spending an average of 15 to 18 minutes per patient and you're asked to address all their chronic diseases, plus mental health, plus housing insecurity, plus, you know, the concerns of everything else, that's not sufficient. So, you know, we're seeing medical students who don't want to go into it. And then I think we need to think about how do we restructure the actual care that's being delivered.
Last time we talked on the radio, we talked about someone I think called in was sort of shopping for a primary care doctor, but only had a certain number of hospitals or practices that he was, I think it was for his parent he was shopping for. There's a pitch to be made here. You're at Boston Medical Center, which is a great facility. You know, we are in a mecca, even though we obviously are having challenges. There's a lot of great doctors out there in a lot of places. So you can, I know you don't want to shop around when you're sick or when you're looking for something, but we do have options.
Absolutely.
Don't just stick to the brand names.
We are so lucky in Massachusetts. We have great community health centers that are, you know, where people live, where people worship, where they go to school, and those are great options. In fact, they really take care of the whole person, the whole family there. You know, brand names. You know, BMC has a brand name too. I think it's really thinking about how do we pay people differently? How do we change the pay structure? So Medicare, Medicaid is on parity with private insurance, right? Because that's going to be the game changer in terms of some people's perspective of where do I go?
Primary care doctors.
Yeah, where do I go if I have this very elite healthcare coverage? Why would I go to the same place where Medicare and Medicaid is the majority of payers or you know, health insurance?
Also, because some of the same doctors are there.
Right. Yeah. I mean, and all of us who work there could choose to be down the street. So, but that's not the point. The point is we all need to be working shoulder to shoulder. It's not about a competition. It's about the fact is that we all need to advocate for a groundswell and change. It's about payment structure, which Governor Baker had started in some of the work prior to him leaving office. Governor Keeley hopefully will pick up that work. Senator Friedman, we've been working really closely with her in terms of of increasing primary care investment for Massachusetts, so really thinking towards the structural changes there. It also means getting lots more people into primary care. So it's not just about the clinician and the patient. It's about the community health worker. It's about the mental health folks. It's about the pharmacist. So making sure that all of those people are at the table and they're all getting paid.
All right, let's talk about COVID.
Sure.
And policy changes. So, you know, this is this emergency change that the federal government is going to do. How's that really going to impact a regular person? What does that mean?
Yeah, so, you know, again, we know that as these things roll out, every state's going to be slightly different. It's very much like what we saw as a pandemic was rolling in, every state reacted differently. We've been very lucky to be in Massachusetts. We know that Mass Health is going to cover people for a lot of things, but there's some places where we need to be aware. So federally, thinking about what's going to happen, we have a huge amount of antigen tests that are still stockpiled. Currently, we're going to still have those be free for people until those stockpiles run out. After that, we don't know what's going to happen. We don't know how much of a demand there's going to be for those tests. So I think that is going to be determined. I think in Massachusetts, with insurance, that will be covered. Same thing with vaccines. People with insurance here will be covered for vaccines. The big thing in terms of a hospital system, especially if you have older parents or you're older yourself, you used to have, during the pandemic, you were allowed to, if you're covered by Medicare, you could go right into a nursing home. Before the pandemic, you had to have a 3-day stay in the hospital before you went into a nursing home. It was like a, you know, a do not pass go, collect $200, and then you can go, and then you can go. And it was actually a really good facilitated way of getting into nursing homes. The question is are we going to roll that back? Are we going to say, actually, you do need to stop again in the hospital? And what is that going to do for a hospital that's already crumbling under this, you know, capacity issue? So I think that's something to be determined. And then finally, I think really thinking about telehealth, which has been an amazing leapfrog for us. I think you brought it up as a relationship issue. It's harder to establish relationships.
Right, but at the same time, it's also an amazing time saver, an access issue, and
an equity issue. So you can have 3 jobs and still keep your appointment with your doctor.
Right.
And so that making sure that we have parity on that moving forward, I think is going to be really important as well.
Where do you think we are COVID-wise? I mean, I'm not going to ask you to predict the future because none of us can, and we don't know what's going to happen. But it feels, as a user, that we've just kind of we've settled in, right? I'm masking sometimes. I'm not always masking. I'm aware of people who are vulnerable. I'm going to follow the directions to get my next shot whenever it's time.
Thank you.
But so we're living with it.
Yeah. First of all, I think the regular citizen has become a public health expert in ways that we didn't anticipate, right? The good news is I think that makes us more aware when we have other viruses, what we should do to protect ourselves and protect others. I think you're right. I think we're sort of lilting in this new normal. The new normal is still pretty terrible, by the way. It's 500 deaths a day. So I think we can't forget that piece of it. You know, I think there's increasing talk about this vaccine sort of being a yearly thing now, maybe when we know the virus will be most rampant when people go indoors and winter and things like that. I'm still sort of calling it peri-COVID, and that, you know, we haven't exited, but we're sort of exiting, or to your point, I think we're exiting out onto a different platform than we were obviously in 2020.
And how are folks, the medical world, reacting to the long COVID? You know, it's bringing a host of issues that people who have had chronic fatigue or, you know, Lyme disease that has lived with them for a while or other viruses. And it's causing some forced progress on those fronts.
Yes, and I think we're still really trying to parse it out because I think, to your point, a lot of those symptoms could be attributed to other things. So we're still trying to distinguish what is sort of the nexus of long COVID versus these other things. How far do the tentacles go of long COVID? I think that probably will be better understood, a few years in the future. The fact is we need to be taking our patients' symptoms very seriously. We always have had to do that, but even more so now.
Well, we appreciate your expertise as always. Great to see you in person. Thanks so much.
So wonderful seeing you. Thank you.
Next up, in one of a handful of unexpected moments at the 2023 Grammy Awards on Sunday, legendary guitarist and singer Bonnie Raitt won Best Song for Just Like That, which tells the story of a mother who donated her son's heart after he died and her meeting with the man who received it.
It was your son's heart that saved me, and a life you gave us both.
The song itself, a work of fiction, but Maine mother Charlene Slaver-Roosevelt couldn't be more real. After her son Joey died in 2016, his organs were donated, and in 2017, she got a message from the man who received his heart, Hamid Mahdavi. Since then, the pair have become incredibly close, and they both join me now to discuss. Hamid is also a member of the Heart Brothers Foundation, a Boston-based nonprofit to support heart failure patients and their loved ones. Welcome to both of you. Thank you for joining me. I want to start with you, Charlene. Talk to me about your reactions to the song, and tell me about your son.
Well, the song, of course, really touches me as it would any mother that's lost a child, being an organ donor or not, but especially. Joey was a old soul is the best way to describe him. He had chose to be an organ donor himself after he and I had a conversation about it, and it was something that he was passionate about. I didn't know he had actually done it until the evening he had passed. He was an amazing young man, and like any mother would say, he just enjoyed doing the simple things in life, playing chess. He was a funny guy too. His sister was his best friend, and it was just an unfortunate accident, that had happened. But in saying all that, getting to know his organ recipients has really helped me in the process of healing. Hamid's letter was just a blessing, and his kidney liver recipient's letter to Julie, I also know her pretty well. So that's really helped me through a lot of this. But I do understand the whole reaction when you hear your son's heart for the first time. When Hamid had walked me down the aisle and he had hugged me, I remember feeling his heart beating through his suit and just really having a hard time, letting go of him. So Hamid's an amazing man, and I really believe the heart chooses the person, and they are so much alike. Very much alike.
Well, let's get to know Hamid a little bit here. Hamid, you had a journey of heart failure and challenges, and luckily you were able to be the recipient of this incredible donation. The journey didn't just stop there, though. For you, it was also about looking to connect with Charlene and the family, but there are understandable obstacles in the way. Talk about what you wanted to do and how you were able to accomplish connecting.
Well, just a little bit of background. Once you are laying in bed waiting for that heart or whatever you're doing, waiting for that call, sometimes you get into this thought of, gee, for me to live, someone needs to pass. And that's a difficult place to be. So after I got the transplant and I wanted to connect with the person, I had a lot of reservations and trepidations of, should I do this? How the person gonna feel? You have no knowledge of who that person is because of HIPAA rules and everything else. They don't. You're not told any of that, so you're like gambling. What is this person want to hear from me? Am I going to open the old wound? Am I going to create more heartburn for them? Which is the last thing you want to do. You know, I'm a father of 2 children and 3 and 1 underway grandchildren. It's a devastating thought, losing your child, and then I just didn't want to bring that back to the forefront. So, make a long story short, the process is you write a letter, you send it to the hospital where you got transplanted, they forward it to New England Donor Services, and then they send it to the family of the recipient. They sort of keep everything blind. And then the opposite, if the person wants to respond, and they'll respond, and then that's okay. So this letter became a major challenge for me. I wrote it a number of times. I tore it up, wrote it, had my wife read it, my daughter read it. It took a while to be able to come to getting the letter to where I wanted it to be and send it. And I had no idea what to expect, and I was totally surprised. We went on a trip. We mailed a letter, went on a trip, and when it came back, there was a letter with long letter from Charlene and a picture of Joey, and it was just all good. It was phenomenal, and we just started a dialogue. I responded to her letter. My wife wrote her own letter to Charlene, and then she replied again, and then I reached out to New England Donor Services. I said, can we communicate directly? They reached out to her. She said yes. And so then we started communicating. First it was a phone call here, a phone call there. And now, at this point, we probably talk at least once a week. And we're probably texting or through Facebook or other social media every day. We're keeping tabs on each other.
Charlene, was that a surprise to get the letter? Was that something that you had expected? I mean, I know I have know folks who have living donor situations with kidneys, and but they know the person who donated it, and I know that there are these safeties for your feelings and for to keep everyone safe as well. But did you expect the letter, and what were your feelings when you got it?
Well, I had been waiting. Like I said, I was already communicating with kidney liver recipient Julie, but I had been waiting for this letter because the Organ Donor Association let me lay next to my son that evening before the process happened, and I got to be with him through every step. And I remember when they came in the middle of the night and said, they had found the first recipient, and I had asked what it was, and they said the heart. And so, yes, I had been waiting for his letter, and I felt a tremendous amount of joy. That was my first, what this man was like, what he was doing, how was his heart, was he healthy, all of that. We're told when a recipient goes in and when they come out, that's all that we're told. For each one, we're called and we're told that. And but other than that, we don't know. So I was excited, but I think the most beautiful part also was his wife writing me as well. And especially when we met the first time, I met so many of his family the first time. That was just beautiful, because you plan in your head what you're going to say, but you really don't know what you're going to say. You don't know. You just don't know. There's a moment of just silence because you just, you don't know. But I remember feeling joy and just wanting to talk to him and wanting to get to know him on a deeper level.
I mean, I know that this isn't an area that you're an expert in. You're an expert in it because it's happened to you. But it's the donor situation is such a challenge in the United States. What the work that you're doing, what do you hear from people who are both, awaiting a donor or thinking about in the living donor situation, volunteering to do a donation?
It's tough. I mean, I do some volunteer work for New England Donor Services, so I've talked with them, I've been to their facilities, and then through my involvement with Heart Brothers, we end up seeing, and there's sort of many aspects to the story. The donors, I think, they do this selflessly, and they want to do that. and God bless them. In the United States, you know, we're trying to get everybody to sign up to be a donor, but people have their reservations, and they're, is it right by my faith? Is it right by my various? And then on the recipient side, especially if it's a past donor, you know, there's a lot of guilt. There's a lot of, because even though in reality you don't control the event or you don't cause the event, but that whole concept of someone has to pass for you to live, that's a hard concept to get over with. And that's why many organ recipients, they hesitate, they don't reach out to their donor families.
Well, the levels of consent, too, through this is also a nice model for all of us.
Right.
In so many ways.
The New England Donor Services does a great job of basically protecting everyone. And I know for Charlene, I tried to get on a project with her to figure out who all the recipients of the various organs and tissue from her son were. And we think it was over 35 people who benefited from it. But when we tried to get all their names and stuff,
it's difficult. It's difficult. Charlene,
Yes.
you know what? Loss and joy, you know, which is kind of the par for the course for parenthood in many ways. But do you have a message for folks who you know are considering making sure that they're a donor on their license and letting their families know?
Well, I'm also on the other side of the spectrum too, as well. My nephew has just received actually his second kidney. His first, he wasn't interested in communicating with the family, but now that he has gotten to know Hamid and the relationship and all of that, he has a different perspective on that. I think it's a very important thing to do. You know, your relationship with your recipients or whatever may not be what mine and Hamid's is, but I know it changed lives, it touched lives. You know, I think of if my son had not been a donor, you know, Hamid's wife would have been burying him, and Julie would be gone as well. Her husband would be burying her, and that thought just is heartbreaking for me. So, you know, I think it's something that's really personal, but I think there's a lot of stigma out there and miscommunication and misinformation. So I think it's very important that, you know, you research it yourself and you contact the Organ Donor Association and get the true facts. Because they're wonderful, like Hamid said, and so is the Hart brothers. So
well,
you know, I do think it's important.
Thank you both. You're both wonderful. Appreciate you both joining us. And thanks, Bonnie Raitt, for making the song and giving us an opportunity to share this story. Charlene, Slaver-Roosevelt, Hamid Mahdavi, thank you so much for joining us.
Thank you.
That's it for tonight. We'll be back tomorrow. I'm Sue O'Connell. Thanks for watching. Good night.